We're back with you on Morning Barbados, and always something good to share. When it's something good and positive, good work happening, we like to shout it out on the mountaintop. So it starts right here. Right now I have the opportunity to share with you about what is happening through the University of Fayetteville. That's Fayetteville State University and Barbados Healthcare Services Research Project. Let me start with the students. We have Amanda Yor, who is a student in the MBA program. Great to have you with us.
Thank you.
All right. We also have Zoe Howard. She is an undergraduate. Good to have you in as well.
Thank you.
All right. Looking forward to hearing about your work. Also, on the other side of the table, we have Dr. Jennifer Bushell-Edgell. She is assistant professor and assistant chair of the Department of Healthcare. It's a mouthful, but critical role indeed. And we also have Dr. Jesse Brown III. He is the assistant dean with the School of Business. So good morning to all of you. Great to have you here to share with us.
Good morning.
All right. Dr. Brown, going to come to you to tell us a little bit about Fayetteville State University, first of all.
Sure. Fayetteville State University is in North Carolina. It is one of the schools in the University of North Carolina system. We're a medium-sized university, but we're doing some big things. And this project here is a collaboration between our school and the University of West Indies, where we're looking at healthcare service delivery and the quality of healthcare service delivery and trying to improve the efficiency and effectiveness of that process. It really works out well for us because in our business school we have a number of disciplines from accounting to finance, management, marketing, and healthcare management.
Yeah.
So we brought a group of our healthcare students here to do some research.
Yeah, we are happy to be thought of. And of course it helps when there's a Barbadian in the midst. So credit must go to Dr. Jennifer Bushell-Edgell. You are a Barbadian, but certainly this can only work out well. I mean, I think even the best healthcare system has its challenges, and certainly in Barbados we are happy for any assistance that's going to help us. So let's talk some more in depth about the research and how it can help our healthcare system.
Okay, well, the project really started about 2009. It's a continuation of the project that looked at the avoidable hospitalizations here in Barbados, focusing primarily on data out of the QEH, but looking at what's happening in our primary care system. And what we did is I formed an alliance with a group of doctors here from the UWI as well as QEH and in the private sector. And we brought a group of students here from Fayetteville State University to work and collect some data in the private sector as well as in the public sector, looking at how much time it takes door to door for patients to be seen, and then looking at patient satisfaction and, of course, potentially avoidable hospitalizations.
Yeah. Okay. So these are just a couple of the students.
Yes.
I would imagine. What have you found most interesting when you've been moving into this research?
One of the things that I found very interesting about this research is just the different diagnoses that come in. Like people come in with a pain, like a chronic pain or something like that, and then later they diagnose it as something else. So, and then like some of the reasons why the different patients come in, some of it may be urgent, and then what we consider in states that's urgent may not be urgent. So that's been interesting. Also, just interacting with the different nurses, talking to them about some of the issues in the hospital, and talking to the patients about some of the things that they see that needs to be changed.
Yeah. Has anything been alarming for you, Amanda?
Just the wait time. In the morning sometimes it's really smooth pace, and then the evenings around 4 o'clock it gets really jam-packed, and like some of the patients, they might have to wait 40, 30, sometimes an hour before they see the doctor. So just looking at the wait time of the patients in there.
Yeah, I think most people probably think an hour would be good.
Yes.
Zoe, what has your experience been like, and what are you hoping to achieve?
The experience has been good. Being an undergrad student, I haven't really worked in any hospitals at all, so this is actually my first experience in a clinic or anything at all. But I think it's been a good experience. Definitely different than the U.S. a little bit, just by a lot of it's vocal. I think there's a lot more electronic messages sent and stuff in the U.S. But it's been good, and we expect to definitely find some sort of way to help out the healthcare in a whole.
Is it too soon to ask whether you have a good idea of what could be some of the immediate fixes for us? And anybody can do it.
It probably is a bit soon because we've not really done a lot of analysis yet on the data. We're in the process right now of collecting the data, and then we'll go back and we'll look at what we have, do some talks and discussions amongst ourselves and with the other doctors here, and to come up with what we think could be a good solution, if we can come up with some good solutions and suggestions.
Yeah, well, let me just read a bit of the goal for the project, the Barbados Health Services Research Project. The overall goal is to examine healthcare system issues in which you plan to create a new international collaborative relationship between the U.S. and Barbadian researchers and practitioners. This sounds like it has longevity.
It does.
A sustainable plan.
Yes, that's the idea. The idea is for us to be able to bring students here and hopefully in the long run be able to take students there as well to work on this project. We're looking at initially 5 years, and then hopefully, if possible, and is as sustainable as we hope, for it to continue on.
Okay. Well, let's talk about some of the expected outcomes then, and you can share in this discussion.
Well, I would probably just follow up with that. One of the reasons why, other than Dr. Bushaleggio being a Bayesian, is we wanted to look at Barbados is because Barbados being one of the most developed Caribbean nations, suffering from similar issues that we're suffering from in the U.S. in regards to healthcare services. And so it gives us an opportunity to look at sort of a healthcare service delivery process holistically by being able to be in a few of the urgent care clinics and being in QEH, where in the U.S. it's not possible to do that. So hopefully we'll be able to find some ways not only to help Barbados but to help the United States, because we're doing similar research in the U.S. as well.
Okay. What do you plan to stay in research?
I do. I previously done research in other countries such as South Africa. So I'm hoping to continue research here in Barbados. With this project, I'm looking to possibly build some simulations to do the workflow process of how the patient goes from door to door. Also, I would like to do some other additional analysis because I have a background in applied mathematics. So,
oh, look at you!
So I'm hoping we'll be able to get a lot of analysis done based off data that we collected here.
Yeah, that's pretty complex a background you have there. Good for you. Zoe, do you plan to stay in the research as well? What are your plans?
For sure. We definitely talked about it, and they're talking about making a trip next year and stuff like that. I definitely want to stay connected. For sure.
Okay. All right. Well, this is something that we can look forward to. So how soon do you think we can see some information coming back that can be applied to our situation in our healthcare system?
Well, I would say as early as probably in the latter part of this year, we should be able to give some information back on what we saw and where we could possibly have some changes within some of the facilities that we've looked at. And the idea too is, like Amanda was saying, we wanted to be able to build a simulation using the data, looking at time and motion door to door for patients. So, and that should be able to help the doctors decide on how many doctors or nurses they may need in a particular facility at a particular time, so that they can reduce the wait times for patients.
Yeah, and keep that flow going.
Yeah.
Tell us a little more about the research team. I know we have two persons here, but tell us a little more about the research team. Dr. Brown.
You know, actually, Dr. Bushaleggio might be the best person because the majority of the research team is here.
Right.
Yeah. Yes, we are currently working with about 4 doctors. We're working with Dr. Shane Williams from QEH, Dr. Brian Charles from Sandy Crest, Dr. Harold Watson, FMH. Dr. Bayer is also part of our project, and Joanne Bradford.
Okay.
That's here in Barbados. And in the United States, it's myself and Dr. Brown and Dr. Sudan that have been working closely with us on these projects.
Have they shared some of the challenges from their perspective, or are you on the same page?
We're on the same page. This is a relationship that has been under development for about 2 years.
Okay.
We've been talking about doing this since 2013 or 2014, and then this is now the results of those discussions.
Right.
And they have shared with us a lot about what they know, what they expect or anticipate prior to us starting the research. But they are very, very interested in seeing what we come up with, if what they think is actually what's happening.
I think the bottom line for any system, whether it's in the U.S., in Barbados, or wherever, is saving money and saving lives and doing so, effectively, efficiently. So can you see, or can you make any parallels, things that work in the U.S., things that could possibly work and help here that you could almost immediately apply?
I think initially, one of the first things we look at is and I think Zoe mentioned it earlier, is the use of electronic healthcare records.
Yes, the apps.
And they're used quite more frequently in the U.S. There's a lot of orders being sent vocally.
Yes, it is.
Yeah.
So, which tends to cause errors and mistakes, and also then there's duplication of records where you're telling someone what to do and you're also writing it down via paper, and then you're taking that and then putting it into a computer database. So if we could take away 3 steps and get it down to 1, that would be immediate impact.
Yeah, and that's something that we've noticed in our research back in the U.S., where facilities have actually implemented an electronic system, and they've pretty much been able to eliminate 1 or 2 steps and then reduce the wait time overall significantly.
That's immediate money saving too.
Yes, yep. And one of the things that we're doing also in this project is we're pilot testing an app that we've developed to look at door-to-door wait times within a facility. So we developed it and we're pilot testing it here in Barbados.
All right. Well, we want to say we wish you all the best. I mean, it can only be mutually beneficial.
Yes.
That's what we want. And certainly we are looking forward to this mutual benefits arrangement here between Barbados and the U.S. And we thank you again for thinking of home. And I hope that your experience continues to be awesome.
Thank you.
All right. Thank you very much. Again, you heard from Amanda Yor. She is a student with the MBA program. Zoe Howard is an undergrad student. Dr. Jennifer Bushell-Edgell is the assistant professor and assistant chair of the Department of Healthcare. And Dr. Jesse Brown III, he is the assistant dean with the School of Business. A pleasure hearing from you on this project. All the best.
Thank you.
Thank you.
All right. We will take a short break. We still have so much to talk about here on Morning Barbados.
Morning Barbados, good morning.